Barber, good morning. Good morning. Good morning. Where's my notes I had? Where those notes I had? Charmaine. Why y'all got these little red things on? I'm gonna watch y'all. All right.
So, Andrew's going to get a microphone. Keep a mic here for a second.
Okay.
Just us there. We got
I want to lift him up there and 42.
Turn it around. Like that. Yeah, that's right, sweetie. I can't wait to turn it
If you're going in, come on around the circle. If you're over at the church, everybody stand on the circle. Make a circle on the circle.
Is this your honey? Oh, yes. I'm Leslie. Like if you're happy and you know it.
All right, make a circle on the circle.
Yeah. If you're happy and you know it's like
Come on, everybody who's at the church, get on the circle. Perry, hey Perry. Just getting everybody on the circle. Come on, bring that on around. Bring it on around.
We're going to make a circle. Get in the circle. Come on.
Yeah, you're right here. Yeah.
Okay.
You want to say that? Let's do that, Vicky. That's good. Let's spread it out till we all can touch. Can I get the doctors in the middle with me? Vicky's going to teach us an old song. Listen. By and by,
Perry.
there is health care.
It's a waiting by and by.
Can the circle be unbroken?
And the circle be unbroken.
Everybody get in the circle.
By and by, Lord, by and by. There is health care. It's a waiting by and by, Lord, by and by.
And the circle be unbroken. By and by. There is health care. It's the waiting. By and by, Lord, by and by. And the circle be unbroken. By and by, Lord, by and by. There is health care. It's the waiting. By and by, Lord, by and by. And the circle be unbroken. By and by, Lord, by and by. And the health care. It's the waiting. By and by, Lord, by and by. Health care. Health care. Health care. Health care. Now, let me ask you, everybody that is going to refuse to give up your constitutional right, raise your hand. I need to see. Okay. Okay, if you want, all of those that are going to refuse to give up your constitutional right, then you need to be on the circle. Those that are supporting those need to be behind. All right? All of those are on the circle, right on this edge of the circle. And those who are supporting, be behind. All right? Make sure we're hooked up, everybody that's going to not refuse to give up your constitutional rights.
Right.
Spread out some. Spread this out. Go spread that way some. What I'm trying to do is get everybody that's going to refuse to hold hands. I'm trying to get that. That make it better? Until we form a complete circle. So spread out so we can see clearly. Dr. Vanderhoff. Here we are. Again. All right, y'all got out of this part of the circle is not, y'all need to spread around. If you're going to refuse to give up, spread it around. Everybody else? Everybody else? All right. Big Gita, can I have one? Yes. All right. So this morning, we're going to first go into the Rotunda, where the judge has said is public space at any time. We won that space. We won that space in the People's House. And there, for the members of the media, we're going to have a brief press conference with a couple. Garrick, where's Garrick? Garrick around? There was some, who's the person you had to come and speak? She is. Come on, babe. When we get in the Rotunda, and we're going to have that happen. And then we have a fact sheet. Everybody got your fact sheet? Yes, sir. Tyler, we got those yet? Let's hand those out. Those of you that are standing on the outside of the circles, hand those out to those on the inside.
Reverend, you are my brother and my colleague because I'm a cantor.
Hey, you a cantor?
I am. The only thing I've ever seen you do that I disagree with is clap on 1 and 3.
Oh! Well, that comes out of my culture, and I can't help that.
No, you're supposed to clap on 2 and 4.
I clap on 2 and 4. Well, when I clapped on 1 and 3 just then.
Right, you did.
Well, I actually clap on the and. See, I'm part Pentecostal, so it's 1 and 2 and 3 and 4.
There we go.
Like, come on. Come on, yeah.
Be unbroken.
Oh, by and by, Lord, by.
There is
Circle.
in the wedding.
By. Oh, yeah, man. Circle. Be unbroken. By and by, Lord, by and by. There is health care in the waiting. By. Now, before we go in, let's get on this and beat. Come on, we're gonna show y'all an and beat. I know it's because it's go 1. That way you can right there. Come on, right there. Then you can do that. All right. Ain't gonna let nobody turn me round. Ain't gonna let nobody. I'm gonna keep on walking, keep on talking, marching up the freedom way. Ain't gonna let nobody turn me round. Ain't gonna let nobody. I'm gonna keep on walking, keep on talking, marching up the freedom way. So what we're gonna do, thank you, is we're going into the Rotunda. Want at least 2 of the doctors to say a brief word, and then we're gonna read the facts. Now these fact sheets are our chants. We're not trying to say a whole lot of new stuff. We're trying to tell the truth. And so when we leave the Rotunda, half of us will go to the speaker's side of the second floor and half to the Senate Pro Tem, and we'll attempt to go into the office because the Constitution says we have a right to instruct. I don't know what they will do per se. We don't know what, but we'll some of it we're gonna have to ad-lib, and we'll stay as long as we have to stay. How many of y'all are ready to stay? Okay, all right. So y'all ready to make it and way to the Rotunda? Yes. All right, so we're going to ask the doctors to lead us. And then we're going to ask, are there any persons in the circle who came and you need health care? Well, I know we all need health care. But in particular, okay, are you, now in the circle, if you got a red, do you have a red band on? The folk with the red bands will lead us in. Our NAACP staff and others are going to be standing around, but we want to put the folks, so the doctors and then the clergy that are going in. The clergy that are going in. Wait a minute, we got some young people. The doctors and then the young people. All right? And that includes Vicky. Huh?
Thank you.
All right. So the doctors, myself, then the young people, then the raging grannies, and then they're the youngest of us. And then everybody else line up, all right? Let's do it. Y'all ready? All right. That's right. And we'll make them. Not one step back.
Forward together! Forward together! One step back! Forward together! One step back! Forward together! One step back!
How you doing?
One step back! Get into not one step back! Forward together! One step back! Get into together! Not one step back! Not one step back! Forward together! Not one step back! Forward together! Not one step back!
Tell them right now to bring it down. Just not one wait till we get to the Rotunda. Tell them wait till we get to the Rotunda.
Forward together!
Wait till we get to the Rotunda. Is my sister here that's going to give her testimony?
Yes, Reverend, I'm right behind
All right. Come on. Media, members of the media, are you all good? Okay, come on. Introduce yourself.
Good morning. Good morning. My name is Jacqueline Marks. At this moment, I have health insurance, but that hasn't always been the case. In fact, if the General Assembly and President Trump have their way, I'll lose my insurance in less than 6 months. 4 years ago, I moved to Scarborough with my 2 children. As a cantor, music teacher, writer, most importantly, as a mother. For 3 years, I did not make enough money to qualify for subsidies through the Affordable Care Act, but I made too much money to qualify for Medicaid. They told me I was one of about 500,000, 500,000 in North Carolina who fell in the Medicaid Gap. The Medicaid Gap could have been filled, but in 2013 our former governor had turned down the Medicaid expansion, which would have been paid entirely by the federal government. All North Carolina had to do was say, yes, please, thank you. But the former governor decided that I and 500,000 others were not entitled to any help. That lack of compassion was repeated last month when the U.S. House of Representatives voted to repeal the ACA. You know what's hard? Life with a pre-existing condition is hard.
Yes.
My daughter has cerebral palsy. I have a genetic mutation that makes breast cancer almost a certainty in my lifetime. God forbid, but it's more of a question of when than if. And the thought of living without health insurance scares me to death. As the Congress tries to shred the Affordable Care Act, it seems like they don't even care. But I have a message for everyone. No matter how fortunate you are, no matter how healthy you are, no matter how much money you have at your disposal to care for that precious health, I've been there and I tell you that life changes in a heartbeat, and you are going to want a plan that allows you to get affordable health care. You want to be ready for this. Everyone wants to be ready. When January 2018 comes, my daughter and I may be uninsurable or unable to afford our insurance, and we're not alone. They say 23 million people will be kicked off their insurance. Shame on the Congress.
Shame.
Shame on the majority that is voting against this piece of good. Shame. How could they? How could they? I work hard. I play by the rules. I pay my taxes in the richest nation in the world. And many in our Congress, not all, many, say we can't afford affordable health care. Our state lawmakers say they can't afford to expand Medicaid. Afford to expand a gift that's been offered to us? When the federal government will pay for 90% of it, it's a shame.
Shame.
I am my children's only surviving parent. They need me to be healthy. They need me not to skip cancer screenings because they aren't covered by my insurance. Senators Richard Burr and Tom Tillis have a big decision. Do they want to vote for a bill that throws 23 million people off of their health insurance? Do they care? No. Well, I hope they do. Because here's why. When you share the light from your candle with another candle, you don't dim your light, you increase it. You increase it all over the place. However many candles you light, that's how you multiply light. You don't lose your light, you create more light. And so a lot of us are counting on them. Senators, statesmen, congressmen, please do the right thing. It's for you too.
That's right.
It's for you. And there are going to be millions of voters across this state and this nation who hold you accountable if you don't do the right thing.
Do the right thing.
The right thing.
Thank you.
Thank you.
Thank you. Do the right thing.
Do the right thing.
Healthcare now.
Healthcare now.
I'm going to ask whichever the doctors are choosing to step up at this time.
Hi, everybody. Thank you, Charlie. Thank you for coming out. My name's Charlie Vanderhorst. I'm a physician, internist, and infectious disease specialist, and I want to tell you about a few patients that I've been taking care of. So one is a young guy in his 20s. Of course, he was covered under CHIP until he was 18. He had type 1 diabetes since he was age 8, and he was in my clinic just a short way down the road here, and with a glucose of 47 and speaking incoherently because he was on a poor form of insulin because he couldn't afford it. He didn't have health insurance. He works at a fast food restaurant. He pays taxes that pay for my Medicare and many of your Social Security, but he himself doesn't have health insurance because of the stinginess and cruel-heartedness of our North Carolina General Assembly. Shame, shame. This young man is a tax-paying North Carolinian who already has eye problems, he's going blind, and half of his kidneys function is gone, and he likely will have an early death, joining 1,000 people a year who die in North Carolina for want of Medicaid expansion. The issue with Medicaid expansion is that it's not just compassion for our fellow humans, it's money as well. It's stupid to turn away federal dollars to keep people out of hospitals.
That's right.
Dumb.
We know. I have another patient, a young woman. She was working, she was paying taxes, she felt a mass in her breast, but then in the economic downturn, she lost her job. Shortly thereafter, she lost her health insurance, and by the time she arrived at our clinic, she had widespread metastatic breast cancer. Now she's on disability, and her cancer care is costing hundreds of thousands of dollars for want of a free Medicaid expansion that would have prevented that.
That's right.
So it's economically stupid and it's immoral.
That's right.
Some people say, why are you bringing the word morality into this? Okay?
Because it belongs there.
It belongs there. If you see someone being murdered, you would intervene.
That's right.
Right?
That's right.
1,000 people are dying each year in North Carolina for want of Medicaid expansion. So tell Senator Berger and Speaker Moore to get off their high horse and do what's right for North Carolina and expand Medicaid.
Do what's right.
Now, I want to tell you about another patient.
All right.
Okay, because although we're in the North Carolina General Assembly, this is a good place to talk about the U.S. Congress.
All right.
So Senator Tillis, as you might know, was in a race running in Washington, and he collapsed. He got a little dehydrated. Now, he had a nice air-conditioned ride in an ambulance to the hospital. He had primo health care on health insurance that was paid by you and me.
That's right.
And 500,000 working North Carolinians who don't have health insurance.
Shame.
Senator Burr and Tillis are millionaires, and yet we're paying for their health insurance.
You're
So-
welcome, Tillis.
You might think many people don't know that the U.S. Congress, in that health bill they passed to get rid of the Affordable Care Act and toss 20 million people off of health insurance, many of you don't know that the Congress exempted their own policies.
They
from
did.
that.
They did indeed.
Take care of themselves.
Yeah, they take care of. So the millionaires, our millionaire senators, Burr and Tillis, are screwing the people of North Carolina while they protect themselves.
Shame.
One last thing that many people don't realize, that in that huge tax cut that they're giving to me, a wealthy physician, they are crippling two major funding streams that are going to Medicare.
Go ahead, John.
So this bill that the House bill that's before the Senate, it's going to screw all of you who have pre-existing conditions.
Shame.
It's going to get rid of free and mandated preventive screening for diabetes, for breast cancer, for colon cancer, for contraceptives, antenatal care for babies.
Shame.
All that will disappear. okay? And the rates, the premiums that people pay currently under the Affordable Care Act are limited, but will all of a sudden go up for the folks between 50 and 64. And it's going to screw up Medicare, which pays for those over 65. So tell Senators Burr and Tillis,
No.
protect the ACA. Keep your damn hands off Medicare. Thanks.
So we want to do a couple of things, and we'll take questions from the media before we begin this sit-in. The hashtag is healthcare for all. You want to get that out, or moral resistance. Healthcare for all or moral resistance. Now I have some intel, and I don't normally do this, but I want us to be reminded that we are nonviolent, and I've got some word that one of the officers said that they're prepared to use all necessary force.
ISIS!
I think that's what Lieutenant or Captain Brock said to somebody. But we not focused on that. And I don't want y'all to get focused on it because, people around here are ordering folk to do something and they think if they do these little scare tactics, folk are going anywhere. To all the media, we never come to get arrested, but what we do come to do is exercise our constitutional right.
That's right.
And our constitutional right says we have a right to petition. Remember, they told us one time we couldn't be in here, and the judge overruled that. I want the media to know that.
Yes. Right.
They arrested nearly 1,000 people, and the judge threw out 968. So we're not the ones that have been in the wrong.
That's right.
They told us 3 years ago we couldn't bring placards in here. That was the Tillis rule.
Yeah.
And the judge said you can't keep the people out of their own house.
That's right.
Bring it. So we love even the officers. Many of them say quietly to us, they know we're fighting for their health care.
That's right. That's right.
And anybody that wants to use all force necessary, just remember, there's a force higher.
That's right.
Whatever you do to the least
there's a force higher than you. And now, the reason we wanted Charlie to come, I say Charlie, Dr. Van Hoff,
That's okay.
is because this is about facts. I'm saying this to the members of the media. And it's about real people. It's not just about numbers. But there's a face on the numbers. And I want you to talk to people today, media, who have people or they are themselves a part of this narrative, because there's so many lies that this legislature has told.
That's right. Yes, sir.
And sometimes they are allowed to say those things and nobody challenges them in the press. Now today, I guarantee you, one of them or one of their political operatives is going to say, well, the reason we haven't expanded Medicaid is because Medicaid is broken. That's a lie. Now, listen, you're right now, amen later, but I want them to hear this. Listen, any human system is flawed.
That's right.
So there's a little bit of truth in every con artist's thing. So to say something is flawed, that is partially true. They're flawed. Everything's flawed. I'm flawed. But it's not broken. And if it's broken because you didn't have enough money, then why are you blocking money from coming in? Number two, if you've been in charge 4 years and you claim it was broken and you haven't fixed it in 4 years, then you have the problem. But unown it. But the truth is, it's not broken the way. Second thing they're going to tell you is they're going to say, all these people are getting Medicaid expansion who are lazy and not working. You can't be at 180% of poverty and not be working. You are a low-wage worker. You are a retired veteran, for instance, because 23,000 veterans. We just did memorial yesterday, and I bet you all these folk were waving flags. I bet you Berger was somewhere waving a flag. But you don't care about veterans when 23,000 veterans are going without health care right now.
Hypocrisy.
It's hypocrisy at the high. Even Congressman Meadows last week, when he was at a press conference, you all saw it. He represents. Now I don't know if he faked it. He don't automatically say that. And if he did, thank God that it came out, because he represents 5 of the most uninsured counties in this state. And he passed this repeal. And when he read what he passed that he hadn't read, he found out at the press conference he passed a bill that would have hurt his own sister and his own daddy. And he teared up about that. Now, my point is to the members of the media, we are here with fact-based civil disobedience.
Yes, sir.
And I want to read you some facts real quick, and then we'll take questions, then we're going to move. Number 1, fact. Article 1, Section 12 says the people have a right to assemble together to consult for the common good and to instruct their representatives. They won't meet with us, so we come meet with them to instruct them and to apply for redress of our grievances. That's why we're here. And the Constitution says secret societies are dangerous to the liberties. In other words, when they get behind closed doors in secret and meet with their lobbyists and meet with their all-white extremist Republican caucus, the Constitution says that's dangerous to the liberties. Number 2, Article 11, Section 4 of the Constitution says beneficent provision for the poor, the unfortunate, and the orphan is one of the first duties of a civilized and Christian state. That means when you do not consider the poor up front in your policies, according to our Constitution, you are uncivilized and unchristian no matter how much you call the name of Jesus, and no matter how much you put your hand on a Bible and swear yourself into office.
That's right. That's right.
These last few facts, and then we'll take any questions. Number 1, nearly 500,000 low-wage, disabled, I want the media to get that. We're talking about disabled folk, children with mental illnesses are being denied, and this all-white Republican Republican legislature is denying over 300,000 white people.
Poor
working class white people that they didn't go ask to vote for them. And 150,000 African Americans. And 23,000, somebody say 23,000.
23,000
veterans. Also, the failure to expand Medicaid is costing North Carolina $3.9 billion a year.
With a bid.
And $10 million a day. That means over the last few years, North Carolina has already forfeited $16 billion. It also means by 2019, if this continues, North Carolina will have lost 76,000 jobs. These are not just facts we pull out of the air. These are footnoted facts. And this expansion is costing over 1,000 people. One study said 2,000 for every 500,000 people denied their lives. Now listen at this. The legislature, they are all part-time.
That's right.
They are not full-time workers. They are part-time. Say part-time. And yet they voted that as part-time legislators, they get the same health care as the governor and all other full-time state employees, and these legislators either receive free coverage or pay as little as $15 a month.
Shame.
Now how hypocritical and immoral is that?
Very. Shame.
Also, among the OECD nation, America stands out as the only nation in the OECD that doesn't have universal coverage. When Trump went to Saudi Arabia, they have universal coverage.
Right.
When he went to Israel, they have universal coverage. When he went to Italy, they have universal coverage.
Right.
Belgium, Germany.
The Trump Care Bill takes $1 trillion murder care, $1 trillion from low and middle income Americans, and hurts mostly white people and mostly the poor working folk that voted for him.
That's right. That's right, man.
Lastly, 1 out of every 4 Americans has a pre-existing condition.
Exactly.
1 out of every 4.
I got one.
And nearly 30 million people will go uninsured if that repeal was to become law. So we're here to protest the General Assembly, and we're here to protest the Congress, and we're here to call on our senators to not support this repeal. What we should be fighting over is how to get everybody universal health care. No, actually, we shouldn't be fighting. What we should be working together on is getting everybody universal health care. And it's a lie when they say they don't have the money, because if you've got $54 billion to buy bombs and weapons that we don't need, and then claim that you don't have the money to make sure people can live and fight the wars against cancer and diabetes and high blood pressure, then that is well, my grandmama called it a bold-faced lie. Members of the media, it's cheaper. Members of the media, are there any questions from you? We want to make sure y'all had a fact sheet, and we're going to send this out. And you can Google us. In fact, you can fact check us. We don't matter. You can't fact check them. That's right. That's right. But you can fact check us. So now we're going to go lead toward the Senate Pro Tem's leader's office, and then we're going to walk down and we're going to split up. We'll tell you what we're going to do when we get over there. So if everybody that doesn't have a red band, if you would kind of part the ways. If you want a red band, anybody that wants a red band to join the crowd, we need you to, do we have any more red bands?
I think I got green.
Huh? Red and gold, you got bands? Okay, if you need to sign up, if the doctors would follow. Oh, Lord. And when we get to the office,
Hey, Doc.
Okay. Let us come through. Thank you. Thank you. Thank you.
Thank you. Thank you.
We might go in another office. Oh yeah, that's all right. Yeah, that's all right. Yeah, that's all right.
You deny health care, people die.
That's right.
What else? Take a right. That's right. Chairman of the Rules Committee? All right. That's right. Since they're closing the Senate pre-tem, is there anywhere we'll go sit in here? Go ahead. Can we have a group sit in there, please? Thank you so much. That's enough. Come on, the rest of y'all, that's good. And y'all can begin to chant in there. Health care.
Health care.
Now.
Now.
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 Health care.
Health care.
Health. Now. Yeah, this all right. All right. Are they agree? That's not private space, sir. I don't. That's public space. That's public space. Whoever's in there, that's not public.
The member's not in right now.
We can still go in. Y'all talk to him. There's a group. We need about how many folk? We need about 10 or 15 people to stay right here. Y'all can stay in, make as much noise you want. Read this, constantly read this, and the rest of us gonna go down to the speaker. All right. But you have a right to be in this.
We have staff members that are trying to work.
That's all
And
right.
on Judgment Day,
Healthcare! Healthcare! Now! Now! 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 Healthcare! Healthcare! Expand! Medicaid! Medicaid! Now! Now! Expand! Expand! Medicaid! Medicaid! Now! Now! Expand! Expand! Medicaid! Medicaid! Now! Now! Expand! Expand! Medicaid! Medicaid! Now! Now! We're gonna go down and try this office. All right? That's right. Well, he closed the door. One time they said it was a felony if they closed. So, you know, we got to watch them, you know, real close. Healthcare! Healthcare! Now! Now! Healthcare! Healthcare! Now! Now! Healthcare! Healthcare! Now! Now! I want some of the doctors and others to get in front and ask to go in this office right here. Where's? Are these all of the folk with red that are? We need all the red up front. Okay. All the red, y'all go to the door. They live there?
Hey, how are you?
I'm fine.
How you doing? Good.
May we pass?
This is a private business office. You're welcome to stay out here. Feel free to do anything you want to do.
How's that a private business office? That's the people's office.
This is a business office.
Business office.
This is the executive legislative assistant to
And
the
they're
speaker.
paid by the citizens of the state of North Carolina, which means that that's our tax money. This is our office.
Business office.
It doesn't matter. It's still our office and it's public property.
When you conduct in business, it's a business.
Well, we come to conduct business. We want to talk to our representative in this office.
The representative is not here.
Well, we want to talk to his workers to see if they'll give him a message.
I'm sorry.
We can't even come in and talk to people.
Is our business.
Healthcare is our business.
Healthcare.
Healthcare
Is our business.
is our business.
Healthcare.
Healthcare
Is our business.
is our business.
Healthcare.
Healthcare
Is our business.
is our business.
Healthcare. Is our business.
Is our business.
Healthcare.
Healthcare
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 Is our business.
is our business.
Come here, say, Doc, come with me. So you're telling me that this preacher and this doctor cannot come in this office, and this doctor works to save lives, and the speaker is working to take lives by not expanding Medicaid, and we can't sit in the office that we all pay for. That's what I want the cameras to get that clear. I'm not going to say to you because they told you.
I'm doing my job.
I won't say you're doing what they told you, but I just want to be clear what they told you.
I'm standing on the premise of what I was told.
Okay, all right. Well, okay, so he's doing what he's told. This is my friend. I ain't mad with him. But see, this says what the speaker and them about.
Right.
It says what the Senate Pro Tem leader is about.
Yeah.
So, brothers and sisters, let's sit in. Let's sit in right here. Y'all got your pillows? You're gonna have to be a while.
Yeah, I got a pillow right here.
I got a pillow. Where's mine? Now, I'm sorry I can't sit all the way.
That's okay.
All right. Those. All right. Who's gonna be the first up to read loud?
I'd love to. Where? Article 1?
Article 1. Stand up, and we're gonna repeat it loud. We're gonna read.
Article 1, Section 12. Right of assembly and petition.
The right of assembly and petition.
The people have a right to assemble to consult for their common good.
The people have a right to assemble together to consult for their common good.
To instruct their representatives.
To instruct their representatives.
And to apply to the General Assembly. For redress of grievances.
For redress of grievances.
But secret political societies. Are dangerous to the liberties. Of a free people. And shall not be tolerated. Woo!
Yeah! Forward together.
Not one step back.
Article 11.
Article 11. Section 4.
Welfare policy.
Welfare policy.
Board of Public Welfare.
Board of Public Welfare.
Beneficent provision for the poor.
Beneficent provision for the poor.
The unfortunate.
The unfortunate.
And the orphan.
And the orphan.
Is one of the first duties. Of a civilized. A Christian. State.
Is there another reader?
Woo!
Yes, sir. Oh.
Getting up in these.
Getting up in this shit. John, come here, I need you to do it.
Our deepest religious and moral values say healthcare is a human right. The extremist, all-white-led Republican caucus in the NC General Assembly and the extremist, all-white-led Republican U.S. Congressional Delegation are denying health care a human right.
That's it. Next reader. Read the next 2 arrows. Where we are. Anybody? All right, we got 3. Y'all 3 stand up, y'all, and then we'll call on you. One right behind Gatewood. Yeah, my brother, my sister. All right, first 2 arrows.
Our deepest religious
We should. Go to the next page.
Yeah.
We should. Y'all don't have to. Wait a minute now.
Yes. Our elected representatives.
Okay, go ahead. Read.
Our elected representatives must figure out how to provide millions of Americans with universal health care instead of take away American health care.
Our elected representatives must figure out how to provide millions of Americans with universal health care instead of take away Healthcare.
If you're not getting arrested, go over to the rails over on that side.
I'm Chief Brock, General Assembly Police. I've received numerous complaints that you're blocking this doorway and you're preventing this office from being able to do their job.
And people are dying!
I am asking you back up. Those who do not be subject to be arrested. Again, I am Chief Brock. I am asking you to lower your voice and back up. Those that do not are subject to be arrested.
Everyone to back up. Everyone to back up. I didn't that way.
And if they don't leave, then what? All right. All right, so we're fine. We're having a conversation. I'm here because folks, supporters, at this time you need to walk over there.
Because people will die in the state of North Carolina if we don't have health care. I'm one of the people that has a pre-existing condition. I'm 57. I'm not Medicare.
I know.
Those that are not getting arrested, go arrested. Do not let this happen. We will not stop. We will not stop.
Sit down here. Health care. What do we want? Justice. When do we want it? Now. What do we want? Justice. When do we want it? Now. What do we want? Justice. When do we want it? Now. What do we want? When do we want it? Now. What do we want? When do we want it? Now. What do we want? When do we want it? Everybody sit down if you're sitting down.
Most continue moving back at the edge of the rail.
If you can sit down.
Let me get over there. I need some room.
Listen up, listen up. Listen up and repeat after me. Listen up. Listen up, those sitting down. Those sitting down. And those out there. The people have a right to assemble together to consult for their common good, to instruct their representatives, beneficent provision for the poor, the unfortunate, and the orphan is one of the first duties of a civilized and Christian state. Our deepest religious and moral values say health care is a human right. The extremists, all white, led Republican caucus in the North Carolina General Assembly, and the extremists, all white, led Republican U.S. Congressional delegation, they are denying health care a human right. We need universal health care. Nearly 500,000 low wage, disabled, mentally ill, poor North Carolinians are being denied. Over 300,000 are white, 150,000 are black.
I need your attention.
23,000. Yes.
We've received numerous noise complaints. And you're also blocking these doors.
They said it was closed. 23,000 veterans. Failure to expand Medicaid is costing the state $3.9 billion in federal funds per year, or 10 million per day, 16 billion since they denied. By 2019, we will lose 76,000 jobs, despite that the legislators are part-time. They voted to give themselves full-time health insurance at low cost. None of them pay more than $15 per month. That is immoral. That is wrong. We shall not be moved. We shall not be moved like a tree planted beside the water. We shall not be moved. Trump care takes $1 trillion from the poor. We shall not be moved. America is the only industrialized country that doesn't give health care to all its citizens. We shall not be moved. 1 in 4 Americans, my brothers, my sisters, my neighbors, myself, have pre-existing conditions. We shall not be moved. Over 30 million people will lose their health care. We shall not be moved. We shall not. They just told me if I keep leading the chants, they'll arrest me. If they arrest me, will you keep chanting? We shall not be moved when we all get together, black and white, Latino and Indian, young and old, gay and straight, doctors, doctors,
you have been asked to leave
and nurses,
if you do not leave
the
at
sick,
this time, you will be arrested.
and the
Do you
broken.
understand?
Yes, sir.
Knowing
When
this,
we
you wish to leave at this time.
get together, no, we shall not be moved. We shall not be stopped like a tree planted by the waters. When we all get together, we'll change this world. We'll change North Carolina. We'll change America. Somebody take the chant. We shall not be moved.
What do we do?
Stand up, fight back.
Under attack. What do we do?
Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back.
Civil police. You have been asked to leave.
Stand up, fight back.
If you do not leave at this time, you will be arrested.
Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do?
I am Captain Standing at the General Assembly. You have been asked to leave multiple times. If you do not leave at this time, you will be arrested. You understand?
Stand up, fight back. Healthcare is under
Knowing this,
attack.
you wish to
What
leave
do we
at this
do?
time.
Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back. Healthcare is under attack. What do we do? Stand up, fight back.
Signs in the flag, ma'am? You want the signs in the flag?
I'm sorry. Thank you.
Whose house? You prove that. Our house. Whose house? Our house. Whose house? Our house. Thank you. Whose house? Our house. Whose house? Our house. Who?
Thank you, we love you. 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 Look at Reverend Barber in the car. Reverend Barber got a... Thank you.
They will lock me up. Thank you, we love you. 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 Woo! Thank you. Our hero.
Folks, if you come in here, please be sure not to talk, please.
I have them right here.
Down here, 3.
All right, I just need for you to sign your name right there.
There is circle in the wedding, by and by, circle be unbroken, by and by, Lord, by and by. There is health care in the wedding, by and by. Before we go in, let's get on this Andy. Come on, we're gonna show y'all an Andy. I know it's good, but it goes 1.
Let's go.
That way you can, right there. Right there, come on. Right there. Then you can do that. All right. You're gonna let nobody turn me around, turn me around, turn me around. You're gonna let nobody turn me around. Keep on walking, keep on talking, walking the freedom way. Ain't gonna let nobody turn me around, turn me around, turn me around. Ain't gonna let nobody turn me around. I'm gonna keep on walking, keep on talking, marching up the freedom way. The unbroken, oh, by and by, Lord, by and by. There is circle in the wedding, by and by, Lord, by and by. Circle be unbroken, by and
What's up? We out. Got 29 more coming out. Hey. Yeah, I'm going in there now.
Did you hear we won the Supreme Court again?
Again? Yeah.
Wow.
I thought that.
3 for 3.
3 for 3. That make it work. Hey, man. Let me see. I'm going to get me a suit like that one day. Let me see my...
Oh yeah, doing good. Doing good. Yeah. Thank you. We started eating here.
We're getting quite a crowd out here, I tell you. All right, all right.
You're on camera, man. Oh boy.
Now he's coming. That's the first time I seen him smile. I told him. The first time I seen him smile, man. This young man, Confusion Film, is a great guy. He taking the evidence of this historical day. Food in there, though, man. That's it.
We did it free at last.
I'm glad he laughing now.
Good evening, family. Good evening, family. Aren't we glad that this movement that we are all a part of is a fluid movement? It is ever changing. The script doesn't always stay the same, so we have to be willing to alter and make alterations and adjustments as they come to us. All right? And we are not going to do a rally, but we're going to do a press conference. And so we're grateful today that earlier today there were some 32 persons who engaged in civil disobedience. Yeah, for the repeal of health care. And we know that we have a right based on the Article 1 and Section 12 of our state constitution that says the people have a right to assemble, to consult for their common good, to instruct their representatives, and to apply to the General Assembly for redress of grievances. But secret political societies are dangerous to the liberties of a free people and shall not be tolerated. That's why we are here, because we do not tolerate all of the secret meetings that the General Assembly has conducted for the past few years. And so we have come into existence the Forward Together Moral Monday movement. Forward together. Not one step back. Forward together. Not one step back. Forward together. Not one step back. Joining us today here are a few impacted people who will come in this order. We will hear from John Thompson, Christina Root, Xenia Eckinson, Garrick Brennan, and Leslie Boyd. Let us greet them with a hearty forward together. Not one step back. Who's first? John? John Thompson. I know he's here because I just talked to him. Followed by Christina Root.
Thank you so much. I'm John Thompson from over in Greensboro. I'll turn 60 this summer. Thank you. I've been married for 37 years. I have 3 grown sons. I'm pro-life. I'm a Bible-believing Christian, and for 28 years, I voted Republican. Now, here in North Carolina, as you get a little bit older, the boss does not have to have a reason to fire you. And in 2013, that's exactly what they did. And when I lost my job, I also lost my health insurance. Now, when my wife and I received the $2,000 a month COBRA bill in the mail, if you've ever lost your job, you know what I'm talking about. That's what it would have cost me out of pocket to keep my employer health insurance. We just looked at each other and laughed. Now, in the past, we would just suck it up and do without and pray to God that no one would get sick or be rushed to the emergency room or have to go under the surgeon's knife, because if we did, we knew our goose would be cooked. We'd be forever branded with a pre-existing condition. We'd never get health insurance again. Well, it took me a year to find another job with insurance. Now, during the course of that very year, those Tea Party nuts right over the way in the legislature slashed unemployment benefits 50%. Also, during that very same year, I got cancer. But thank God for Obamacare. The marketplace had just launched. I signed us up immediately. The tax credit helped us to afford the premium. It was our lifeline during my year out of work. In fact, Obamacare saved my life. Without it, I would have been uninsurable for the rest of my days. No diagnostic test, no surgery, no rehab, no hope. Have you ever sat by the bedside of a loved one and watched them slowly and needlessly die of prostate cancer? Well, I have, and it's not a pretty sight. Now, I'm not a deadbeat or a freeloader. For 40 years, I've paid my taxes. I've worked to support my family. I've given to my church. I've contributed to my community. But in my moment of need, when my back was against the wall, in the richest country here in the history of the universe, where was the GOP for me? In fact, if they could have done to Obamacare then what they're getting ready to do to it now, shoot, I'd probably be lying dead in my grave somewhere today. So I'd like to speak to our GOP representatives, because this might be the closest I ever get to saying what I want to say to them. My question to you guys is this. Now, there's no evidence over the last 40 years that tax cuts on the rich and big business either pay for themselves, trickle down to the rest of us, or do anything on our behalf. When you get rid of Obamacare and you replace it with Trump Care, and then you pass your tax reform bill. Now, it's important to remember all three of those are interconnected. You guys are giving big business in the top 1%, those elite million or so families way up at the very top making more than $400,000 a year or more. You're giving them a massive $3.8 trillion tax cut. Now, that's a huge number. With $3.8 trillion, you could pay off the entire annual budget deficit of the United States in 6 years. For $3.8 trillion, you could fund a 4-year college education over at UNC Chapel Hill for every baby born in North Carolina for the next 64 years. I mean, there's a lot of good stuff you could be doing with $3.8 trillion, but instead of it, you're giving it away to a bunch of rich folks. Now, in addition to that tax cut that you're giving to the wealthy, to my GOP friends, on the one hand, you're giving those massive tax cuts away to a small group of fat cats who don't deserve it and certainly don't need it, while on the other hand, you're going to gut Obamacare and rip away affordable health insurance from 20 million of us. Secondly, you're going to strip away pre-existing condition protections from another 50 million of us. The New England Journal of Medicine estimates that 50 million innocent Americans are going to lose their lives, and you're also going to increase the budget deficit by over $6 trillion. Our Republican colleagues, I'd like for you to explain to us how that is going to make America great again.
All right, thank you, John Thompson. Now we will hear from Christina Root. And let me say this, everybody. I'm one of the nicest guys that the Forward Together Moral Movement knows.
This is true.
And I'm asked to keep you to a limit. So I have to do that. So when I tap you on the back, please acknowledge and give someone else a chance. Christina Root.
scroll down here, sorry. Good afternoon. My name is Christina Root, and I live right here in downtown Raleigh, right up the street, actually. And about 2 years ago, before going out for a run right down Person Street to City Market, I discovered a lump as I was adjusting my sports bra. After many mammograms, ultrasounds, MRIs, and several biopsies, it was confirmed that I did have breast cancer. I was 42 years old. After more tests, it was determined that I had a rare and aggressive type of breast cancer called triple-negative breast cancer, and I was already at stage 3. My world turned upside down, and I entered into what I call the vortex of hell. Because of the aggressive nature of my cancer, I began chemotherapy right away. I did 16 rounds on an accelerated program. I wound up having to have blood transfusions, trips to the ER during this process. I took more medications than I can even recall. At the time, I was single and living alone and sometimes too weak to walk up the stairs. Prior to that, I had been in the best shape of my life. I ran almost every day, but then I found myself in the fight for my life. Less than 4 weeks after finishing the 16 rounds of chemo, I was fast-tracked and had my first mastectomy. 4 weeks after that, fast-tracked 35 rounds of very high-dose radiation daily. And after that, I made the decision to continue another 6 months of chemotherapy preventatively in the hopes that my cancer would not return. At this state, this is about all that I can do. I have additional surgeries that I can do preventatively, but there are no more treatment options for this particular kind of breast cancer for me to take. The current Obamacare plan is far from perfect, and I personally have had quite a few frustrations with it, including my insurance getting inadvertently dropped through no fault of my own. It's an imperfect system for sure, but the answer is not to repeal it and replace it with the proposed HCA that's now in the Senate. Everybody wants lower premiums, and I certainly don't have the answers, but I do know the answer cannot be to allow states to opt out of the very provisions that have saved mine and so many others' lives. Though I consider myself a moderate, I am indeed a registered Republican.
It's all right.
But I stand before you as a registered Republican and a breast cancer survivor and say that thank God that health insurance companies cannot charge me 2 and 3 times more than other policies because of my pre-existing condition. That's right. Thank God for the ACA. Thank God that because of the ACA, women are finally able to get the genetic testing for a BRCA mutation to see if they're at risk of getting breast and ovarian cancer, and be able to get those preventative surgeries that will save their lives. Before this mandate, women were afraid to get this very simple genetic test for fear that they would be dropped by their insurance. How many women have needlessly died of ovarian or breast cancer for fear of the rates going up? This is a huge change that's protected under the ACA and cannot go away. That's right. Thank God the insurance companies can't impose a cap on my insurance coverage because of my pre-existing condition. The cost of breast cancer, I'm scared to even total it up. I'm probably approaching $1 million, I would guess. Thank God for the Affordable Care Act. And members of Congress who want to allow states to opt out of mandatory pre-existing coverage need to know that that is not the way to go. That's right. If this happens, I don't think that the General Assembly would do is in our best interest. They will not. I don't have faith in Congress to make changes to the Affordable Care Act that are going to help me, a single woman who is a breast cancer survivor. The CBO office says that my health care bill could possibly go as high as $50,000 a year. $50,000 a year just for my premium. This can't be the case. I don't know the answers, but I know that the current bill that's in the Senate, the ACHA, is not the way to go. Please help me continue to fight for health coverage that people need and deserve in the richest nation on earth. Thank you.
I hope you all heard something that Christina said, and that was that she is a Republican. Her speaking here to us this afternoon is evidence that this movement is not about Republican and Democrat. It's not about left and right. It's about right and wrong.
That's right. That's right now.
Tell it.
Good afternoon. My name is Zena Erickson, and I'm here because I'm not willing to be a bystander to the regression of North Carolina. I came here today frustrated that this illegitimate legislature chose to deny health care coverage to many North Carolinians, to cause people to suffer even though economically it would make sense to expand Medicaid. Just to tell you a little bit about me, I'm 22, I'm a student full-time, and I'm a caregiver for my great-grandmother. I'm with her 24/7 every other week, and despite working long hours providing health care to someone else, I'm uninsured. The reason I can't be on my parents' insurance is because they're both disabled and on Medicare. If North Carolina expanded Medicaid, I would qualify. I want people to understand I have a pre-existing condition and I suffer every day. But I'm not the only one suffering because Medicaid was not expanded in North Carolina, nor am I suffering the worst. So you can understand my frustration with this illegitimate legislature choosing not to expand Medicaid, denying access to health care to many North Carolinians. But they got it wrong. Health care is a right, not a privilege. And we are And we are all here today standing up for our rights again. We must protect the interests of our communities, and we understand we need to be talking about expanding access to health care, not stopping the Affordable Care Act from being repealed. We are all here to remind our public servants they have a job to serve us as their constituents. And that not only means expanding Medicaid so that people like me can have access to health coverage, but fighting for a universal health care system so that everybody can have access. Because after all, health care is a right, not a privilege. And we will not back down. Forward together.
Not one step back. Christina, stand here with me for 1 minute. I want you to know that Christina is the secretary of the Youth and College Division of the North Carolina NAACP. Zena. All right, we will now hear from Ms. Leslie Boyd.
I have a quick message for the legislators who had me arrested this morning. The Affordable Care Act would have saved the life of my son, who died because he was denied care. And the people who are against expanding access to health care to all of us like to call themselves pro-life and Christian. But they will see judgment. And on Judgment Day, I predict, they're going to go in and they're going to try and sit with the lambs, and Jesus is going to say, you're in the wrong seats. You belong over there. And they're going to say, but Lord, we love you. And Jesus is going to say, really? Because I was hungry and you cut food stamps and Meals on Wheels and school lunches, and I was thirsty and you allowed polluters to poison my water, and I was sick and you voted 60 times to repeal the Affordable Care Act, and you refused to expand Medicaid, and people died, and I was in prison and you allowed somebody to make a profit off of my misery. Whatever you did to the least of these, you did it also to me. Go away from me. I do not know you.
All right. Forward together.
Not one step back.
Now we are going to hear from the medical professionals. We have two folk representing. One is Susan Eder, who is a psychiatrist, and she will be followed by Sarah Crier, who is a physician assistant student. Let's receive them with a hearty applause.
Hello, my name is Dr. Susan Eder. 4 years ago today was the first time I was arrested at the General Assembly while engaging in civil disobedience. I was there to protest the callous legislature and its refusal to accept the Medicaid expansion and allow 500,000 of our fellow North Carolinians to have access to safe, quality, and affordable care. Today, I am here to talk about the same issue. And I can tell you, it might even get worse. I am weary, I am disappointed, but I am not giving up.
That's right. All right. All right.
I am speaking as a doctor. I'm a child psychiatrist. I've worked with families in the most desperate of situations. They have children with autism or bipolar disorder, or they have adolescents struggling with chemical dependency or suicidality. Before the Affordable Care Act, these families who only wanted the best for their children could not get care because these were considered pre-existing conditions, and they had what we then callously knew of as a carve-out. Thankfully, President Obama managed to get the ACA passed in 2009, and insurance companies were no longer allowed to exclude people because of these pre-existing conditions. But the cruel, callous North Carolina legislature did not expand Medicaid, which was part of the ACA, and 500,000 people had to go without health care. Now President Trump and the Republicans, or I guess we have another term, we're not supposed to say Republican. The extremists in Washington have passed a bill that will take away people's access to health care. It is estimated that 23 million people will lose health care under the bill that passed through the House of Representatives. Cuts for Medicaid spending run deep and are amongst the cruelest parts of the bill. The CBO estimates that $800 billion to $1.4 trillion will be cut from future Medicaid. Many of these people that will be hurt are the most in need. They are the poor, the elderly, and the sick. Insurance companies will again be able to deny coverage to those with pre-existing conditions, and in some cases, lifetime caps will make them unable to continue. I am speaking as a physician, but I'm also a patient. In 2008, I was diagnosed with stage 4 metastatic melanoma. I have been fortunate. I've had insurance, and I've had access to the best doctors and nurses at UNC Hospital. Shout out to UNC Hospital. But I look around the waiting room in the areas of the cancer center, and I think, who amongst these will lose their insurance? Is it the man in the wheelchair? Is it the person on oxygen? How is it possible that we have a legislature that does not care about these people? How can they be so cruel? What is wrong with our country? Healthcare is a civil right, not a privilege. I was arrested in 2013 protesting the legislature for denying health care. I was arrested again in 2016. I do not love being arrested, but we all need to step forward. Forward together, not one step back.
Good evening. My name is Sarah Cryer, and I am a student in the Duke Physician Assistant Program. The PA profession has a long history of working to increase healthcare access. However, in the direction our state and federal government is moving, our goal of providing affordable, accessible care is getting harder to reach. Access to primary and preventative care is essential to improving the health of our state. This was most evident to me prior to coming to PA school when I was working as a nursing assistant in a nursing home. The people I cared for were in a position of dependence because they did not have access to care for their preventable chronic diseases. Many had undergone amputations from untreated diabetes and had suffered strokes from poorly controlled hypertension. The Affordable Care Act provides North Carolinians with preventative care to keep them out of nursing homes, keep them gainfully employed and paying taxes, and prevents the high cost of nursing home care. Additionally, the people I work beside are those most affected by North Carolina's refusal to expand Medicaid. Because NC did not expand Medicaid and management would not hire us for full-time work, these nursing assistants could not afford health insurance. One coworker was diagnosed and treated for gestational diabetes during her pregnancy because pregnancy qualifies for women. Unfortunately, her diabetes did not resolve post-pregnancy. Having lost insurance, she was unable to receive care, leaving her vulnerable to complications of uncontrolled blood sugar. A new mom working as many hours as she could, she did not have the resources or education to manage her disease. The patients I took care of and my friends at work are who drove me to apply to PA school. These people are whom I think about when I'm studying late at night. I'm asking, demanding, that the NC legislators support the Affordable Care Act and expand Medicaid. Our most vulnerable. Our most vulnerable citizens need access to basic health care to prevent future diseases and costs. I saw women doing backbreaking, emotionally difficult labor days and nights when they themselves did not have access to basic health care. This is a shameful way to treat those who wash the bodies of our elders, aged and infirm, and give out medications that they themselves cannot afford. We need to make healthcare more accessible to prevent my friends from needing the same care they are providing. Thank you.
Let's give these medical professionals another round of applause. And certainly to continue amplifying the situation, we have some clergy people here today. We have with us Rabbi Leah Citron and the Reverend Dr. Nancy Petty.
The Jewish tradition teaches us that human life is of infinite value and that the preservation of life supersedes almost all other considerations. As a Jew, I believe that God endowed humanity with the understanding and ability to become partners with God in making this a better world. And we must be active partners in this pursuit. Providing healthcare is not just an obligation for the patient and the doctor, but for society as well. It is for this reason that Maimonides, a revered Jewish scholar, listed healthcare first on his list of the 10 most important communal services that a city had to offer its residents. Almost all self-governing Jewish communities throughout history set up systems to ensure that all their citizens had access to health care. Doctors were required to reduce their rates for poor patients, and when that was not sufficient, communal subsidies were established. Here in North Carolina, now in 2017, we must apply our moral obligation and demand that our elected officials represent our voice. Healthcare must be accessible and affordable for all Americans. As the sun sets this evening, the Jewish holiday of Shavuot begins. On this holiday, we mark the transformation of our people from slavery in Egypt to freedom to worship our God. We have counted the days since Passover. Tonight is the 50th night. And now we stand prepared, ready to symbolically receive Torah at Mount Sinai. Shavuot reminds us of this brit, this covenant, this partnership that we have entered with God, and we must honor that partnership by demanding justice. Thank you.
Rabbi Citron has spoken to you out of her religious tradition and her beliefs, and I come to you now to speak out of mine. Remember the number 35. 35, say that. 35. That is the number of stories in the 4 Gospels that tell the stories of Jesus healing the sick.
That's right.
35.
35.
Specific stories with people named that Jesus took the time out of his busy schedule to heal and to give them health care. Think about that. We have elected officials on Jones Street who claim to be people of faith. They claim to be God-fearing people.
My God.
That's right. One of them is from my home county, Cleveland County. I know the church the man goes to. And yet, they're willing to put laws and policies in place that do not care for their neighbor. they would rather hold on to power. They would rather make their next dollar on the backs of the poor and those who are down on their luck, who don't have health care. And so we have to keep pressing. It is, as Rabbi said, our moral obligation as a community. And for those of us who dare to call ourselves Christians, the burden is especially on us to hold up those 35 stories and to follow the example of the man who we say we follow and try to be like. Now, sometimes it feels like what we do doesn't make a difference. But I'm here to give witness to say it does.
Yes, yes.
If we want to save our health care, if we want to fight this repeal, we have to stay in the march. We have to stay in the battle. We have to show up and be present and do whatever the moment calls for us to do.
That's right.
And I'm here to give witness to the fact that a movement that started in North Carolina some years ago has made a difference.
Yes, yes.
We've seen how the Moral Monday movement has made a difference in North Carolina. And we can't express our gratitude enough to the leader who brought us together.
That's right. That's right.
Democrats, Republicans, Libertarians, liberals, conservatives, black, white, gay, straight, trans, brought us all together in the state of North Carolina to make a difference. And people all over the world have watched as the Reverend Dr. William Barber has led this state to make a change. And you heard just 2 weeks ago where he's even more committed to taking what we've learned and what we're doing in North Carolina and changing the moral course of our nation. And so now, I give to you the Reverend Dr. William Barber.
And I want today to give it back to the we. And I want to, first of all, have all of the folk that just got out of jail to make your way up here. 32 people, just now, don't move, just somewhere around. Just come up in front. You don't have to come all the way in front. Just come to the sides. Because we is the most important word in the justice vocabulary. And then I want to make, yes, right, give them a big hand. And then I want to make a few comments. And then I want to have my friend and my leader, who leads all of us in many ways because he's the president of the Council of Churches in North Carolina, brings together Jewish and Christians and Muslims. Dr. T. Anthony Spearman is going to close us today. I remember when we first went to jail in 2010, and we were criticizing Republicans and Democrats who were passing a regressive budget. I want to start today not only acknowledging those who got arrested, but to let you know we are so right to fight and we keep winning. That's right. Winning may not have come quick, but it's coming because the race is not given to the strongest or the swiftest, but those that endureth unto the end. And today, the Supreme Court said again to North Carolina, you're wrong. You're wrong. Miss Rosanelle Eaton, you're right, they're wrong. And it sent the case back to the North Carolina Supreme Court and said, get the law right, redraw these districts right, and stop engaging in racism. And that's a powerful victory. We've got work to do. But again, it reminds us that this is not so much about Republican and Democrat. It's about an extremist all-white caucus that has hijacked the Republican Party and is passing laws in a way that are unconstitutional. And that means they are unconstitutionally constituted, and they're passing laws that are unconstitutional. And I know some of y'all say lock them up, but I don't want to lock them up because then I got to pay for them. I want them to send them home. I don't want to lock them up. Yes, send them home.
Send them home! Send them home!
That's right. And then after they go home, I want a new group of legislators to come in and undo everything that they've done. We fight because we have a moral duty. We don't want history to be written, and we didn't stand up. It doesn't matter what man's law says. There's a higher law. There's a moral law. And I want you to know we're not fighting. I'm glad my sister said that the Affordable Care Act is imperfect. It is. Every piece of human legislation is imperfect, and surely the Affordable Care Act has places it could be fixed to add more.
That's right.
I'm glad she said that. But you know, we got to also think about what we didn't have before the Affordable Care Act. The way I put it is, I got a car, and it ain't perfect. But I got a car.
That's right.
Some of my tires are run down because y'all call me all over the state, and I don't have enough money to put new tires on, but I got a car. But before, when I was back home and young in the country, I had to go everywhere on my feet because I didn't have a car. Well, before the Affordable Care Act, you didn't have protection if you had a pre-existing condition. It's imperfect, but you didn't have millions of people being covered that are now would not have been covered if you didn't have it. You didn't have the ability for children to stay on their parents. You see, we got to think about what we didn't have. So what we have now is imperfect, but what we had before was nothing. So I'd rather have an imperfect something than to have a whole lot of nothing. And if this country is going to work on anything, we ought to be working on universal health care for everybody. I want to say a few more words because so many people, thousands are dying, millions need health care, and it's just wrong to desire and not to deny it. And I want to be a tag team preacher for a minute. Dr. Spearman knows about this in AME Zion Church. They tag team sometime. I want to make a few passing comments and turn it over to him, and then we'll take questions from the media. And if you want to hear more this coming Sunday at 4 o'clock, is it 5? Where's Jonathan? Is it 4 o'clock? We're having the gathering every month, once a month on first Sundays. At 6 o'clock. What time is it? 6 or 4? Y'all get it right. Whatever time they look on the internet. Okay. It's on the 4th at 6. And we'll be having a time, we'll focus on a moral issue every first Sunday. It's invited to all people, so I'll talk more then. And it's going to keep us together, keep us organizing. But every one of those legislators over there, especially in the all-white extremist side. I want to say that. I'm not being racist. That's the truth. It's all white. And the reason I keep saying that because the majority of the people that are hurting are white. The majority of the people being denied health care are white. 32 states expanded Medicaid. 19 didn't. None of the southern states, where white people are the poorest. Now, 6 out of 10 black people live in these states, but the majority of the populations are white. So they're hurting mostly white people, then they're hurting a high percentage of black people and brown people in these 19 states. None of the southern states, none of the states that used to be a part of the old Confederacy. It's like the legislators in these various southern states are stuck in the past. They can't bring themselves. 32 other 6 states that were led by Republican governors expanded Medicaid. And when they talk about the system being broken, it's not broken. It's being sabotaged. It's being jimmy-rigged. That's what we used to call it. Yeah, somebody's throwing a monkey wrench in the system. There would be 8 million more people covered today if these 19 states, all who need it, states that have the poorest population, the poorest and the whitest population, and yet you have these all-white extremist Republican-led, I don't like to call them Republican. My granddaddy was a Republican, so it's kind of, but he was a Lincoln Republican. He was a Theodore Roosevelt Republican. Yes, very different. And they feed many of my white brothers and sisters this mess about prayer in the schools, and they're against the gay people, and they're against abortion and pro-life, and they're for tax cuts, and they try to prove that Jesus was an original member of the NRA, and they use that mess to trick people. And then they come here and they vote against your very life. And they vote against your children's lives. They vote against your children's lives. And I'm telling you, and then almost every one of them, I bet you if we went over there, Dr. Spearman, tomorrow, and asked them, do you believe in Jesus? They'd all holler yes. If every one of them made sure they brought a great big old Bible when they got ready to be sworn into office and put their hand on that Bible. And some of us know that Bible. Some of us don't just put our hands on it. Some of us can know it. And one of the things I know is something Rabbi Heschel said, a Jewish rabbi. He said, and I want to paraphrase this, you forfeit the right to worship God when you mistreat the sick, the poor, and the broken.
That's right. That's right. That's right.
Rabbi Heschel said that. He said you forfeit. In fact, he told John Kennedy 4 days after Medgar Evers was killed, he wrote him a telegram. He said, you forfeit the right to worship God when we mistreat the Negro. He was talking about civil rights, and he said, this is no time, this is the time for moral grandeur. This is not the time to sit back. And so I just decided, I'm going to give this to Dr. Spearman to close out, but these folk got some strange religion.
Hello.
The various states, these poor states that have the highest number of so-called religious right, so-called white evangelicals, are the same states denying Medicaid expansion. Now, they claim to know so much about God, but they do so much that's contrary to God.
Yes, sir. Yes, sir.
And I thought I might prove it, since we got people all over live stream. And by the way, millions of people saw us today, and it was trending. So don't ever think. See, I come from a tradition that says 1 can chase 1,000 and 2 can put 10,000 to flight. So you don't tell me what 32 people getting arrested can or cannot do. 32 people getting arrested can light up Facebook. 32 people getting arrested can light up the internet. 32 people getting arrested for the right reason can trend all across the world. People are inspired. But I thought I might just say Psalm 103 says, praise the Lord, my soul, and forget not all his benefits, who forgives all your sins and heals all your diseases.
Yeah.
That's in that book that they, all your diseases.
Yeah.
And then Jesus, I kind of hang out with this brown-skinned Palestinian Jew that was a revolutionary that got crucified. In Matthew 8, it says Jesus came to Peter's house. He saw Peter's mother-in-law lying in bed with a fever. He touched her hand and the fever left. Didn't say, he said, do you have an insurance card? That's right. Said she got up and began to wait on him. And then it said when the evening came, many who were demon-possessed were brought to him. And he drove out the spirits with the word. And then it says, and he healed all the sick.
That's right.
Now, there are two words in the Old Testament, and I'm through, and the New Testament when it comes to healing and sick. All. Psalm says God, one of the benefits of God, he heals all. Matthew says Jesus saw him and opened up his clinic after hours.
That's right. That's right.
After hours. And said, come on.
That's right.
Come on. I'm healing all.
That's right.
Everybody.
All.
So you can't claim to love God
That's right.
and claim to be pro-life if you're not passing policies that are trying to heal all.
That's right.
Because the moral imperative of God is we ought to be healing all. Doesn't matter if they're a millionaire or poor. All. Doesn't matter if they've got AIDS or cancer. All. Doesn't matter if they're black, brown, white, Native American, Asian. All. Doesn't matter if they're Republican or Democrat or Libertarian or Independent. All. Doesn't matter if they have a pre-existing condition. All. Doesn't matter if they have a mental disease. All. Doesn't matter if they've got a card in their pocket or no money in their wallet. The text says all. And America, it's time. If you claim to serve God, you better get into this all business. North Carolina, it's time. If you keep reading the Bible in your legislature and opening your session with prayer, you better stop playing with God, because God declares all are to be healed, all are to be loved, all are to be respected. All, let me slap Dr. Spearman a high five and say, take from here.
Come on. Bring it
All. Brothers and sisters, the North Carolina Council of Churches, over which I preside, has been supporting health care initiatives for the past 20 years. And we're still fighting now.
Yes.
This lets me know that we are living in a time when an immoral and civil war is being waged against us.
Yes, sir.
It was in the context of the Civil War that President Lincoln offered a prophetic framework to ensure the survival of America's representative democracy. That government of the people, by the people, and for the people shall not ever perish from the face of the earth.
Yes, sir.
It was Plato who once said, democracy is a charming form of government, full of variety and disorder, and dispensing a sort of equality to equals and unequals alike.
Yes, sir.
Yet an extremist group of lawbreakers, an unconstitutionally constituted band of outlaws, who have even been called rogues by some,
yes, sir,
have made innumerable attempts to dismantle our democracy.
Yes, sir.
And we must resist, yet resist in peace.
Yes, sir.
When the government refuses to raise the minimum wage to a healthy living wage, you are fighting an immoral and civil war.
Yes, sir.
When the education of your children has become unhealthy and severely compromised, you are fighting an immoral and civil war.
Yes, sir. Yes, sir.
When our lesbian, gay, bisexual, transgender, and queer sisters and brothers are othered and attacked, you are fighting an immoral and civil war.
Yes, sir.
When your right to vote has been suppressed and disrespected, you are fighting an immoral and civil war.
Yes, sir.
When legislators refuse to acknowledge the thousands of people living in poverty, you are fighting an immoral and civil war.
Yes, sir.
When legislators refuse to expand Medicaid to help the poor and needy, you are fighting an immoral and civil war.
Yes, sir.
When the crafters of new health care legislation include a list of pre-existing conditions, the likes of which would deny millions of people the right to appropriate health care, you are fighting an immoral and civil war. Do any of you have any of these conditions? Alcohol or drug abuse, acne, Alzheimer's, anorexia, arthritis, cerebral palsy, congestive heart failure, heart disease, diabetes, hepatitis, kidney disease, and the list goes on and on and on. You may be denied health care, and that's just a conservative list. When you have legislators who were elected to serve by the people, and those legislators consistently refuse to abide by the Constitution by permitting the people who elected them to instruct them, a right which is expressly guaranteed by Article 1, Section 12 of the state constitution, but rather turn their backs doing what they want to do, make no mistake about it, you are fighting an immoral and civil war.
Yes, sir.
But we praise God above, who has supplied us with the moral authority and weaponry that can and will set us on a new course. Just as God equipped David with 5 smooth stones with which he defeated his Goliath, he provides us with a 5-point justice system, smooth enough to secure new measures of justice and equality. We have pro-labor, anti-poverty policies that ensure economic sustainability. We have educational equality that ensures that every child receives a high-quality, well-funded, constitutional, diverse public education. And we have health care for all by ensuring access to Affordable Care Act, Medicare and Medicaid expansion, Social Security, and by providing environmental protection. We cannot lose with the stuff we use.
Yes, sir.
Our vision is in sync with Article 11, Section 4 of the state constitution. And more than that, our 5-point justice system is in sync with the Word of God.
Yes, sir.
Once upon a time, in Matthew's 11th chapter, Jesus, immersed in building a powerful movement, had just met with members of the FTMM, Forward Together Moral Movement of his day. After meeting, Jesus took them on a teaching and preaching tour. He was anxious for them to work on reframing the term, we the people. When word came to Jesus that his jail mentor John was questioning whether or not he should be worried about the progression of the movement, Jesus sent word back to John by saying, look, y'all go back to John and tell him that we're carving out a domain by going to the root of the problem and talking to the poorest in our day.
Yes, sir. Yes, sir.
Let Barber, John, Know that the movement crew is busy confronting systemia and holding this empire, those with some power, accountable. Tell John this: we ain't got no time for foolishness. We're offering the blind new sight by supporting the expansion of Medicaid. We're bracing the lame by supporting prison reform. Lepers are being cleansed because we support immigrant reform. The deaf are starting to hear because housing reform, labor unions, and those who thought they had no chance in life are beginning to believe that their lives really matter. You tell Barber, I mean John, not to worry. We got this. Nobody is going to stumble on our watch. We got this. Not the children, not the women, not the gays or the strays. We got this. Not the butcher, not the baker, not the candlestick maker, and not the felon. We got this. Then Jesus turned back and began to characterize the generation of his day. He said, these extremist folk are like spoiled brats sitting in the marketplace pouting. We want to jump the rope of racism and play hopscotch with hatred and surf the net for computer games of violence and vitriol. And all these freedom fighters want to do is work, work, work. You all need to know that the fierce North Carolina State Conference of Branches Forward Together Moral Movement has staff members the likes of which this world has never known. Fearless litigators anywhere, and we have some of the most cooperative clergy folk anywhere. And we have some of the most courageous allies and friends anywhere. We don't shrink back. We won't turn back. We won't hear and turn back. We'll forever hear the charge. Forward together. Not one step back. Forward together. Not one step back. Forward together. Not one step back. You go tell Barber, I mean John, that we got this.
Yes, sir. Yes, sir.
Are there any questions from the media?
We got one more. Where's Tyler? Tyler? Those of you who have not signed this, where is it?
There's
Is it another one?
There's about 4 of them, yeah.
Yeah, we're going to put them right up here.
Here's another one. There's about 4 of them. There's about 4 sprinkled throughout.
As he's coming, as we prepare, we're going to hold hands for a moment. Brothers and sisters, I can remember in 2006 when we began working together. The first event was held in my church the last Saturday of December, and we knew then, even when Democrats were in office, that somebody has to raise the moral standard. I want all of you to know that are listening by live stream that I'm honored to forever be a part of this Forward Together moral movement. It's been healing. Some of you all don't know that some years before I became president, I was crippled for 14 years. Walked on a walker, needed a wheelchair. The more I've stood with you, the better my body's gotten.
Hallelujah.
And so I owe you all a debt. There's something about when we stand together, Dr. Spearman and others who are here, Keith and others who are here. I want you to know that we're not leaving. People keep saying we would leave. Nobody's leaving. I'm going to be here. But we've got to spread this movement.
Yes, sir.
Y'all got this right.
Yes.
Dr. Spearman, we got this.
Got this.
So we're going to join with others to build a Poor People's, Poor Children National Moral Revival that will have 80 days of action from Easter of next year to June 21st in 25 states, including North Carolina and the District of Columbia. And you'll hear more about that. I remember when we had no staff, and Deborah Tyler Horton worked for the Justice Center, was our first coordinator to help do administrative work, and then so many others. No person has been the main anything. That's right. I remember going all over in every crook and cranny, Garrett, of this state, building relationships, because sometimes it ain't about the policy. If you can build relationships, they can last. And sometimes I reflect on all the hours and the many who helped build that are now deceased. Those that are gone on. But God has been good. I remember, Doc, the first time we got arrested, it was simply for asking a question: what doth the Lord require? I remember when we first had the first Moral Monday, Dr. Mendez, and you were one of the 17, and there were 7 clergy and 10 folk, 1 lady. And really what made the hit that day wasn't so much us getting arrested, it was the fact that we'd been in this movement, and when we did, people said something must be mighty wrong. And then it was Merle Breeden with cerebral palsy in a wheelchair, and they arrested her. You remember that? And the picture went all over the page. It wasn't my picture. And folks said, what in the world are they doing arresting people in wheelchairs who are fighting for other folk? We didn't even call it Marmon, didn't even have a name. Name came about 2 weeks later, Jackie. I remember when we finally got a little staff, you know, Reverend Gatewood and Laurel, Reverend Kojo, Attorney Jamie and Kayla, Tyler, Jasmine, Yara. Got a little staff to help out Maida. But even with staff help, there's no one person. The volunteers made this movement. Building relationships made this movement. You bring in all your skills and wisdoms. And then by the grace of the divine spirit, I remember when we went to Asheville after 14 weeks here, we went out to Mitchell County, and to organize the NAACP in Mitchell County ain't nothing but God. That ain't had nothing to do. It had nothing to do with no human being. Just, all the thing you can say is I was a vessel. That's all you can say. And then Leslie, I remember that next day, 10,000 people showed up, and they said it was the biggest rally ever in Asheville. And I looked out and I turned to somebody and said, right now we all need to say to God be the glory. We don't need to take any of this credit. That's right. At best we can say we're just going, one's going to plant, another's going to water, right, but God's going to give the increase. So when people ask me how is the movement going and how is it going to go, I say the movement's going to be fine. And I only have one warning. It's going to be fine as long as we, not I, is the center. As long as we know one individual or group that tries to claim the credit, they're wrong. There ain't been really no chiefs. You ever notice I've never been called the president of the HKOJ? I just took convener. Bill Mars asked me what convene mean. I said, just try to get folk together. The only folk who worry about titles are folk that don't have a testimony. As long as we commit to be servants of justice, as long as we listen to wisdom. I remember that day when Mother Eden said, we just can't turn back. And I tell you, that's one of the reasons you'll never hear me say, I built the Forward Together Moral Movement. What you tried to hear me say and try to model is by God's grace. I got an opportunity to be a servant. You got a little assignment of grace. Paul called it a measure of grace. But we is the most important word in the justice vocabulary. It's not what any one of us alone can do, but what we all can do. So I don't know how you retire from a volunteer. So y'all stop telling that. Ain't nobody retiring. In order to retire, you got to have a salary. We're expanding. and taking what we've learned to some other states so that next year, for 80 days, we can have unity in America, addressing systemic racism and poverty and the war economy and national morality. And we're only able to take it because you have been at the center of building a movement that is changing the country and changing the South. And as PPP polls said, when we started, they laughed at us, but after 3 years, they laughed themselves, some of them right on out of office, right back home. The courts are starting to agree with us. We know the grace of God has been with us, and for those who may not be religious, but they believe in the moral arc of the universe, haven't we seen that arc bend time and time again? And we ain't tired yet. And I feel real comfortable getting on the road and getting my old raggedy van out there for 25 states and hopping on trains and planes because I heard that y'all got this. Amen. Amen. I've got a feeling everything's gonna be alright. Whoa, I got a feeling everything's gonna be alright. Don't you know that I've got a feeling everything's gonna be alright. Be alright, be alright, be alright. Don't you know the Spirit has done told me everything's gonna be alright. Don't you know the Spirit done told me everything's gonna be alright. Let's finish. Don't you know the Spirit done told me everything's gonna be alright. Be alright, be alright, be alright. Amen. Let's go to work. Forward together. Say it. We got this. 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 We got this.
We got this.
We got this.
We got this.
We got this.
We got this.
We got this.
We got this.
We got this.
We got this.
And now are we going to march these over to the legislative building?
All right. What do we want? Health care. When do we want it? Now. What do we want? Health care.
When do we want it?
Now.
What do we want?
Health care.
When do we want it?
Now.
All right, let's march on down.
Health care. Now. Health care. Now. Health care. Now. What do we want? Health care. When do we want it? Now. What do we want? Health care. When do we want it? Now. What do we want? Health care. Not one step back.
The buildings are all locked up and there's no one here.
Okay.
Except for housekeeping and police staff.
Can you take it in for us? Okay, that's big great.
Not one step back.
Thank you so much.
Not one step back.
You'll take it in. We got one more. We got one more coming. So, yeah, hold on. We'll get. We'll just hang on. We'll get the other one.
What do we want? Healthcare. When do we want it? Now. What do we want? Healthcare. When do we want it? Now. What do we want? Healthcare. When do we want it? Now. Yeah. Healthcare. Now. Healthcare. Now. What do we want? Healthcare. When do we want it? Now. What do we want? Healthcare. When do we want it?
Now. Rock's gonna take them in.
Healthcare.
Rock, they're closed.
Healthcare. Now.
All right.
Oh, sorry, honey. You brought a good word.
Mr. Rock.
Yes. I'll be glad to receive them and take them. I can
Thank
take,
you, Chief.
I can take one to each office. I can take them.
Not one step back.
Hold it 1 minute. Hold it 1 minute. All right, so we're trusting these, we're putting these in your care and trusting that these are going to get into the hands of those whom we're seeking to get them into the hands of.
Speaker
Moore and Senate Leader Berger.
I'll take one to both offices.
That would be wonderful. And we appreciate you and thank you. And you'll be seeing us again.
I understand.
Let them know that.
Yes, sir.
All right?
Thank you, Chief.
All right.
Forward together.
Not one step back.
Forward together.
Not one step back.
Forward together.
Not one step back.
All right.
Well done.
Hey. Forward together, more movement.
Give it to them. Don't throw it away.
Listen up. They'll give it to them.
We work hard on that.
Listen up.
You got to work.
This is the time when we really need to stick together
That's right.
and show people, the whole world, that this movement is not about one man.
That's right.
We know that Dr. Barber has inspired the movement.
That's right.
And we know that he'll continue to be among us.
That's right.
And we have to take the spirit that he has led us with and move this movement forward.
That's right.
That would be something that would do his heart a world of good as he goes on to a larger sphere of doing justice work. The Poor People's Campaign.
That's
So
right.
let us be the wind beneath his wings. Let him always know that the Forward Together Moral Movement, we got this.
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 We got this.